examination. انتوا خدتوا بالفعل اعتقد السيستمز examination او ما اخذتوه بالميديسن؟
دكتور اخذنا ذكر هيستوري وجنرال اكزامينيشن بس الكتروني بلش
بالالكتروني. تمام. ف بالهيستوري هو سيم طبعا. احنا حكينا على الهيستوري هوايه وامتحان بيه. يبقى الجنرال اكزامينيشن واللوكال اكزامينيشن بالنسبه للكارديو فاسكولار سيستم. احنا راح نحكي كل الجنرال اكزامينيشن اليوم. راح نكون فقط نركز على شغلات الموست امبورتنت بالجنرال اكزامينيشن related to the cardiovascular system. الجنرال اخذته اعتقد عليه سيشن او سيشنين هو اللي لهم علاقه بالجنرال. يبقى this is the important parts in the general examination you should look for in the when you examine the patient with cardiovascular disease. اول شيء عندنا هو الديسمورفيك فيتشرز او any dysmorphic features. طبعا احنا every examination should be start from the above top of the head to the tip of the toe. حتى ليش نبدي من الهيد للنيك للابدومن respiratory الشيست الابدومن حتى ما ننسى يعني region بالجنرال examination. ما نقمز من فوق الجو ومن الليج للهاند حتى السيستمز نغطيهن. فمن الهيد عندنا بالبداية examination عندنا any dysmorphic features أو any abnormality بالفيس. many syndromes عندنا بالبيدياتريك. انتم ما طالبين بالsyndromes النيمز مالتها. there is hundreds thousands of syndromes, but if you found any abnormality you should mention what is seen by your general examination. Many syndromes associated with cardiovascular disease. إن شاء الله على محاضرة السنة القادمة بالمرحلة الخامسة راح يكون عندكم بالكورس الأول ناخذكم محاضرات الكارديوفاسكولار سيستم الكونجنتال هارت ديزيز. راح نشوف عندنا many syndromes associated with congenital heart disease. Example عندنا Down syndrome associated with endocardial Cushing defect like VSD, Turner syndrome of aortic stenosis, Noonan syndrome associated with pulmonary stenosis, and many syndromes associated with congenital heart disease. What else in the general examination you should look for? Color, polycythemia, jaundice, and cyanosis. هاي الكلرز دائما تخلوها ببالكم بالجنرال اكزامينيشن. ما اريد احد ينساها. تعطينا هواي انفورميشن على البيشنت و نقدر نستفاد من عندها بهواي شغلات. عادة patient with congenital heart disease associated with anemia usually they are presented with failure to thrive because of their disease. So usually they have iron deficiency anemia and also may present with polycythemia in addition to the anemia because of chronic hypoxia. So they will present with anemia and iron deficiency anemia and polycythemia. Also, this patient may develop heart failure and we may see a tinge of jaundice in the examination of the sclera. And some of the patients may develop cyanosis, and this type of cyanosis, as you know, we have two types, the central and peripheral cyanosis. The most important of them is the central because associated with pathological diseases, while peripheral cyanosis may be physiological due to temperature changes or anything else may cause peripheral cyanosis. So it is not so important like the central cyanosis. What else in the general examination? We may see sweating on the forehead, the patient with heart failure. You should open the mouth of the patient. You look for any dental caries. Those patients may be liable for infective endocarditis. So any caries you should mention it in the examination. You should examine the hand of the patient and see if there is any clapping of the fingers. Um, this may indicate cyanotic congenital heart disease or infective endocarditis. Usually the clapping develop after 6 months of age. Before 6 months of age, you should not look for the clapping or mention it because it is a chronic process, need a long time to develop. So not looking for any clapping in a neonatal period or a patient with 2, 3, 4 months of age. In the spine, you should look for any chest or spine deformity like scoliosis, kyphosis, the back. Usually, the students need forget it in the examination. You should examine the patient from front and from the back. Going to the skin of the hand, you should look also for uh, any nodules like genuine lesion, splinter hemorrhage in the nails, and these are signs present usually with the patient with infective endocarditis. You should look for it. And lastly, you should examine if there is any leg edema or sacral edema, and you know usually how to examine for leg edema. In the general examination, you should took it previously. Also, if there is any bony abnormality like absent thumb, absent radii, these usually associated with syndromes, you should mention it if the patient have any bony abnormality in the general examination. Then you should go to the examination of the pulse of the patient, and you should check for a radial pulse of the child. Usually, we didn't measure. You should not look for it before 1 year of age because it is difficult to be examined. So, usually, when you assess the radial pulse, the patient should be above 1 year of age. What you look for in the pulsation, you should look for the rate, rhythm, volume, character of the pulse, if there is any radiofemoral delay, and you should also, if there is any asymmetry of the pulsation, you know, there is usually bilateral comparison between the left and the right side of the patient, of the upper and lower limbs of the patient. When you examine anything, have two parts, you should compare usually between the right and the left side. طبعا عندنا احنا الهارت ريت هذا different مو مثل الادلت التم normal heart rate usually 60 to 90. احنا هنا بالبيدياتريك age group the heart rate is different according to the age. المفروض اخذتوها بالجنرال examination. Usually the neonate the heart rate is from 120 to 160. Toddlers from 90 to 140, the preschool age from 80 to 110, and till the adolescent and adulthood reach the normal range, which all of you know it, from 60 to 90. So every age group have a different heart rate, different from the according to different age group. So if you count the heart rate or the pulse rate, you should calculate it for about 1 minute. دائما وصلت